Osteoporosis is a disease that thins and weakens the bones to the point that they become fragile and break easily. In other words, bones with lower density are at higher risk for fractures. Typically, there are no symptoms in the early stages of bone loss. Frequently, the first symptom of osteoporosis is a fractured bone. Other symptoms may include, but are not limited to, back pain, abnormal curvature of the upper back, and loss of height. The risk factors for osteoporosis are advanced age, having a thin, small-boned body, family history of osteoporosis, early menopause before age 45, a diet low in calcium and vitamin D, cigarette smoking, excessive alcohol consumption, long-term use of medications that may cause bone loss, and being Asian or Caucasian. Osteoporosis is usually diagnosed by your doctor using a combination of medical history, physical examination, and measuring your bone density by means of a DEXA scan, which is a safe, painless X-ray technique. Disability is a consequence of hip fractures. 20% of these patients require long-term nursing home care, and about 60% fail to return to pre-fracture level of function. Chronic back pain, loss of height, and impaired lung function are common consequences of vertebral fractures. All of these together add up to reduced quality of life and loss of independence, which for most of us is considered the most significant. Because lost bone cannot be replaced, to treat osteoporosis, we focus on prevention of further bone loss and fractures. The treatment consists of regular exercise, adequate intake of calcium and vitamin D, smoking cessation, and the use of medications. If you want to know if you are at risk for osteoporosis, you can contact your primary care physician, gynecologist, orthopedist, or rheumatologist for evaluation. By taking your medical history, physical examination, and if indicated, a DEXA scan, your doctor can make a decision on the treatment you may need.